Okay, good morning, good afternoon, everybody. I'll talk a little bit about EarlySense. EarlySense is a leader in digital health. And I can say that after monitoring over 1 million patients being installed in hundreds of medical institutions, helping save thousands of lives, prevent tens of thousands of hospitalization days, and hundreds of millions of dollars savings for hospitals, I can safely say that bringing AI and predictive analytics into the healthcare world is very, very challenging. It is tough and takes time, but the outcome is outstanding. And what I'll talk to you a little bit today is three of the key points that are required in order to actually achieve better results with digital health and advanced AI and analytics. One is gathering accurate data. I think we have the wrong presentation. I don't know if you can change it. One is gathering accurate, continuous data to develop the predictive analytics. Two is developing the actual predictive analytics engine. And three is driving effective intervention, human intervention, through AI in order to reach better outcomes. And I'll walk you through all three of these points, how we did that, and how today we actually help save thousands of lives every year. So the first point is to collect a lot of data. And our favorite fairy tale at EarlySense is The Princess and the Pea. You probably heard about that story. We like to collect a lot of data without putting any burden on the patient or on the clinician. And we do that like the princess and the pea. We are the pea. The sensor goes under the mattress and through that collects very accurate information on heart, breathing, motion, every heartbeat, every breath, opening and closing of the aortic valves, sleep analysis without ever touching the patient. First question is, does it really work? So we went out and checked how many mattresses can we put the sensor under and still collect every heartbeat, every opening and closing of the aortic valve. One mattress, 2, 3, 4. It turns out, actually, we can go up to 6 mattresses and still collect very accurate data. Our sensor, you may be able to see it here, placed under all these mattresses, collects vibrations coming from the body without putting anything on the body, any mattress, any setup, hospital, nursing home, or home, collect continuous, accurate data with no setup. So that's the easy part, getting a lot of data. Then the next step is to actually develop predictive ability to detect when something bad is going to happen for the patient. A cardiac arrest, a situation of respiratory depression, meaning when the breathing goes down, when you get pain medication, or sepsis that we'll talk about in a minute. To do that, we collected all the data continuously, as said, but also ran deep analytics, AI, to actually find the early warning signs of deterioration. What you see here, for example, are how we separate between patients who are doing well or not doing well for cardiac arrest on respiratory and cardiac patterns. And once you've done that, you have a lot of data. You have a very effective sensor to collect the information, like our sensor that goes under the mattress of the bed and collects the information with no setup. We can also use today other sensors, like finger sensors and others, into our analytics engine. With that, we now can tell and provide clinicians early warning when something begins to go wrong. And that's still not enough, because we know we can collect the data, we know when something may go wrong, but we have to drive intervention by the clinicians in order to generate outcomes. And that's probably the most complicated thing we have to do, because you have to change human action by letting them respond to an AI-based analytics engine. And how do you do that effectively? That's what we've been working on for several years before we got the actual outcomes. So we developed a tool that allows, our sensors and systems are implemented and installed, as said, in hospitals, nursing homes, across the United States, Europe, and some into Asia as well. We developed a system to actually analyze how is the clinical engine used, how are clinicians responding to our system, how quickly they're responding to alerts, whether they're responding to alerts according to protocol. And what you see here are some examples of our analytics engine that are then delivered to the managers to help them make sure that their teams actually respond to our AI alerts on time and effectively. Because without that, the engine is there, it delivers the alerts, but the clinicians don't necessarily respond to it in time and effectively. And you can imagine, for example, a situation where a hospital has hundreds of our sensors installed, and there is some mistake in the setup, and too many alerts are generated. Too many alerts are generated, we get into what's called alarm fatigue, what we like to call here the story of the boy who cried wolf, right? So you get many alerts, you get alarm fatigues, people don't respond to the alerts, patients, God forbid, actually die, even though the system works well, the predictive analytics works, but clinicians are not responding to it because they don't trust it. So we actually use these tools remotely and analytically to provide reports to the managers to say, okay, your site is actually like a patient sometimes, trending in the wrong direction. The implementation quality is going down. Nurses and doctors are not responding to alerts because they don't trust the system, and you have to change something in the setup or bring our experts in order to actually use the AI more effectively. So again, it's not just the predictive engine, but it's also the tool to analyze how the medical institution is implementing it. And to some extent, we look at the medical institution like a patient. It can trend in a positive direction or it can trend in a negative direction, and we actually run analytics on the quality of the implementation and provide our expertise and our tools to help this quote-unquote patient achieve better results by using our tools effectively. And when something goes wrong, we give the early warning, intervene with our clinical expertise, and the site goes into a better situation. Another thing that's very important to do is to build the confidence and the excitement of the clinical staff in our system. One of the things we do for that purpose, we actually collect case studies or reports where our system actually helped save the life of a patient. I'll give you an example. One of the biggest risks that face patients in hospitals is what's called a sepsis or body-wide infection. Hundreds of thousands of patients die of sepsis every year in hospitals. The chance of survival of a patient with sepsis goes down by 8% every hour. Every hour, 8%. That means early warning and quick intervention by the clinician is critical. Our system analyzes the situation, alerts on the early warning sign of sepsis, and then checks whether the alerts are responded to in time, and if not, alerts the management. And by doing that, we've collected many, many cases where we've actually given early warning on sepsis. Patients were intervened, given the antibiotics in time, and their lives were saved. That's the time, and then with such a report, we share it with the whole team, and the whole team then builds the confidence in the system going on to save the next patient from sepsis and the next one after that. And by doing that, we don't only use the AI again to provide the early warning, but analyzing and detecting this event allows us to publish it within the site and within the group of sites, build the confidence, and then drive the better implementation of the AI tool. So what do we actually achieve with that? You see that the unique thing is that actually after doing all these three steps of data collection, early warning, and effective implementation with analytics engine, you get dramatic improvements in medical outcomes for the medical institutions, hospitals, nursing homes, and soon homes. Here, for example, hospital data, we reduce the length of stay, we shorten the shorten the time in the hospital, but we also prevent cardiac arrest by 86% and falls and pressure ulcers as well. More importantly, today we also help not just save lives, but also save dollars. Not more importantly, but just as important for medical institutions. And with our systems installed, sites save over $15,000 per year per system. Lastly, one more example I'll show you is it's not only about saving lives, sometimes it's about something easier like helping patients sleep. It turns out that with advanced analytics, you can detect the low-risk patients. One of our issues in our medical systems is that we actually take too much care of the safe and health patients, the ones that are stable. So with advanced analytics, you can actually detect the patients who are doing well, and we don't have to wake them up at night and take their vital signs. So we save the time of the clinical teams, we let the patients sleep better, and we make the patients more satisfied, which generates higher patient satisfaction scores and better revenues for hospitals. So it's, by doing that, we not only use analytics to tell you, this patient is at very high risk, we have to give him antibiotics or resuscitate him, but also about 50% of your patients in hospitals and 80 to 90% of your patients in post-acute sites are doing well. And we're doing a lot of extra tests and extra effort to check on them because we don't know that they're stable. So what we've just proven with the University of Chicago is that not only analytics can help us detect the high-risk patients, but also the 50% of the patients that are stable, and those, we can let them sleep at night, we can keep the clinicians not working on them but on others, and provide a much more efficient medical health system. Finally, here is a summary of the impact that our solutions made across the world, and why, what we call at EarlySense, why we do what we do. So our systems helped save over 3,000 lives, 28,000 ICU days, over 180,000 hospital days, and over $168 million. And all of that by combining accurate continuous sensing, advanced predictive analytics, and AI tools to actually help implement and drive the right human intervention at the right time, at the right place. And with that, we see a great future for AI in healthcare by distributing sensors across the continuum of care, combining that combination of AI and predictive analytics on right implementation, and allowing patients to stay out of the high-risk areas, the lower-risk patient care, and driving better health outcomes clinically and economically. Thank you very much.